Hello everyone. Today we are going to discuss a new topic regarding unconsciousness and syncope. Introduction to unconsciousness and syncope. First of all, we will see about the unconsciousness. Here we can observe that some person is laying down without any response. These both are the medical emergencies which can be caused by the different factors. Sometimes it may be life-threatening if not managed properly or early. So, in this video, we will see about the causes, pathophysiology, diagnosis and management of unconsciousness and the syncope. Definition of unconsciousness and syncope. First, we will see about the unconsciousness. It is an abnormal state in which a person is not alert and not fully responsive to his or her surroundings. Here, in this what happens means the patient will not be alert and he is not oriented to his or her surroundings. The levels of unconsciousness ranges from drowsiness to collapse. First of all, the patient went into drowsiness and later he went into collapse. And it may ranges in severity from fainting to coma. When coming to the syncope, it refers to a sudden loss of consciousness, followed by the spontaneous, rapid and complete recovery. Here what happens, there will be sudden loss of consciousness. Later, it may lead into spontaneous recovery or complete recovery. Causes of unconsciousness and syncope. First one, cardiovascular causes. The syncope may be due to the different cardiovascular conditions such as arrhythmias, structural heart diseases and the hypertension. In case of arrhythmias and all, if the abnormal heart rhythm such as a bradycardia or tachycardia happens, there will be the decreased blood supply to the heart. Thus, it leads to syncope. In case of structural heart disease, the conditions such as the aortic stenosis or hypertrophic cardiomyopathy, it may lead to syncope. In case of hypertension, what happens? There will be the low blood pressure. In case of low blood pressure, it leads to the decreased cerebral perfusion. Next, we will see about the neurological causes. Unconsciousness cause will be caused by the neurological conditions such as the seizures or the stroke. In case of seizure attack and all, there will be the abnormal electrical activity in the brain. It causes seizures. Whereas in the stroke, what happens? There will be the interruption in the blood supply to the brain. If the blood supply to the brain is not passed through, it leads to the unconsciousness. And some of the other causes which leads to unconsciousness and syncope such as medication side effects, dehydration and the hypoglycemia. Stroke leads to the obstruction of blood flow to the brain that ultimately leads to brain damage. Cardiac rhythm also, there will be drop in the blood pressure. In case of brain tumor, what happens? There will be the increased pressure within the skull. As the tumor size increases, there will be the increased pressure within the skull, thus ultimately leading to the syncope. Pathophysiology of unconsciousness. Here, there will be different types of syncope. In case of neurally mediated syncope, it is the most common cause. It will be caused by the reflex response of the autonomic nervous system. In this neurally mediated syncope, what happens? There will be sudden drop of blood pressure and heart rate. In case of cardiac syncope, there will be the disruption in the heart's normal electrical conduction system. Thus leads to decreased blood flow to the brain, leads to unconsciousness. In case of orthostatic hypotension, there is a sudden drop in blood pressure when in case of standing up or from a sitting or lying position. It leads to decreased blood flow to the brain. Thus, some of the patients who are completely lying down from so many months, if they are getting up from the sitting or lying position, we need to tell them to lie for to sit for some time or to lie out for some time, and afterwards only we need to tell them to get up. Otherwise, orthostatic hypotension will take place. Thus leads to syncope. How can we identify that the patient went into unconsciousness and syncope? First of all, history and physical examination. In case of unconsciousness and syncope, a detailed history and physical examination will give the more information about how the unconsciousness happened, how the patient went into syncope, like that. In case of ECG, it helps us to diagnose the cardiac causes, and blood test identifies the metabolic and the hematologic causes. CT and MRI helps us to know any structural abnormalities or any blood clots in the brain. We can able to identify that. Management of unconsciousness and syncope. First of all, in the initial management, if the patient went into syncope or unconsciousness, we need to ensure the patient in a safe position. Like, to prevent from further injuries, we need to keep the patient in a safe position, and we need to keep the open airway. If the patient is unconscious, the airway must be clear, because that it may further block the airway. And if required, we need to ventilate the case. And if the patient is in shock, intravenous fluids and vasopressors may be required. Diagnostic tests includes ECG, echo and blood tests. A tilt table test helps to identify the syncope. And the investigations such as CT or MRI, it will be necessary to identify any structural abnormalities. Next, pharmacological therapy. In some cases, medications such as beta blockers or calcium channel blockers, it helps us to prevent further attacks, further episodes we can prevent. In other cases, the medications such as atropine and epinephrine, if the patient is having arrhythmias and the patient suffers with bradycardia or hypotension, we need to administer atropine or epinephrine. Surgical and the other interventions. By doing the CT and MRI, if any structural abnormalities or any blood clots found, to prevent further attacks of stroke or any other symptoms, we need to do the interventions such as pacemaker implantation, cardiac ablation, or surgical repair of aortic dissection. And in some cases, further lifestyle modifications such as dietary intake, doing the exercises, and giving the psychological support to the patient and family members, it helps us to improve the situation of the patient and helps to prevent further episodes. In case of this syncope and all, assessment and continuous monitoring of the patient is very, very important. In case of initial assessment, we need to take the detailed history, physical examination, and a complete vital signs measurement. And the patient medical history includes the patient's age, gender, medical conditions, medications, and family history of syncope or sudden death. And the physical examination, we need to monitor for cardiovascular and neurological systems, including the assessment of heart rate, whether it's bradycardia and high blood pressure, like if the patient is having hypertension, and the neurological status, complete GCS under we need to monitor. And monitoring and the diagnostics tests, such as ECG, echo, tilt table test, and blood tests. It helps us to monitor the electrolyte levels and the cardiac enzymes, whereas CT and MRI helps us to know the structural abnormalities. The continuous monitoring must be done for the patients who are suffering with this unconscious syncope, because the further episodes of syncope can be prevented by reducing the factors that induce the warning signs. Thus, these both are the complex medical conditions which helps us to know the thorough understanding of their causes and management. We need to monitor the patient carefully, and we need to provide the proper management to prevent further episodes. In this condition, we had seen about the definition, causes, pathophysiology, and further management, how we will prevent the patient symptoms.